And now scientists are warning the coronavirus could cause brain damage. Experts at the University College London say COVID-19 could lead to neurological complications. These include strokes, nerve damage and potentially fatal brain inflammation. And it can happen even if patients don't show severe respiratory symptoms. Well, let's discuss this with Adrian Puren from the National Institute for Communicable Diseases. Adrian, good morning. And as you can imagine, we've caused a lot of panic right now with what we've just said. So just make some sense of it for us. How credible is this? How true could it be?
Yeah, so I think we need to acknowledge that, in fact, even though we focus a lot on the fact that the main focus of this virus is on the respiratory system, in fact, it has a wide range of effects on other systems as well, including neurological effects. So, as you know, one of the other key symptoms that has been recognized is, in fact, the loss of smell and the loss of taste, for example. And there is some evidence, in fact, that this particular virus does affect the central nervous system. In fact, some of the strokes that have been observed under these particular conditions is thought to be a result of the coronavirus actually activating, for example, the blood clotting system, and that could probably lead to those particular types of symptoms. But we also know post-COVID infections that, in fact, people do have hallucinations, fatigue, and a whole range of other possible conditions. And it's thought that the result of this is probably the result of the activation of the immune system. As you know, we've spoken about this, for example, the cytokine storm. So it's thought that the immune system is probably activated, and what we're seeing really is a consequence not of active infection, because we think that that is probably clear, but that you can have multiple episodes of activated immune system responses, including some of these neurological effects that have actually been observed.
So, Adrian, just for clarity then, would it be linked to comorbidities? For example, if it leads to any kind of stroke, would it be that you would have had to have had a blood pressure problem, probably suffering with hypertension or whatever it is? Or could it be that this virus itself could just cause that for somebody who has none of those comorbidities, nothing to suggest that they would have suffered brain damage or a stroke, for example, at any point?
Yeah, so as far as I'm aware, I'm looking through some of the brief literature that I have, it does not appear to be actually linked to a specific comorbidity. In other words, it's a result of the actual virus activating, for example, the clotting system, for example, or the immune system, or both, or combination, leading to the effects that we are currently observing in a whole host of individuals. And again, it's not being done systematically. We don't know how many people are experiencing these particular post-COVID symptoms, but I think it's there. It must be recognized, and I think we need to manage that. I know, for example, in the UK and other countries that there are support groups, so I think and studies, in fact, to actually keep track of these symptoms in order for us to get a better sense of the nature and extent of these symptoms and how to actually manage them. And I think it's not unique to coronaviruses. In fact, it has been recognized in MERS and SARS-CoV-1, for example, that people actually have these long-term neurological effects.
All right, so in some cases it could be temporary, in other cases could this lead to permanent brain damage? What are we noticing at the moment?
Yeah, so I think it's very difficult. I think we're only 6 months in, as it were, so we don't really know. So it would be those, as I said, if people are enrolled into studies, then in fact one would then get a sense of what is the duration of these particular symptoms. In fact, the median so far of symptoms is about 10 days, but in fact we've seen these some symptoms go on for much longer, or in fact they may disappear and recur, in other words, at this particular stage of the disease.
And would we most likely see this then in older patients, Adrian?
No, I think it seems to be in a range of patients. It's not specifically geared, it's not the right word. It's not obvious that it's only in older patients with comorbidities, for example. I think it's across a whole spectrum of people, and in fact in a whole spectrum of disease. In fact, you would think that mild disease may not have these, but in fact there have been reports with people who have experienced mild disease who actually have severe effects. But for specifically around the lung, for example, those are probably people who've actually had more severe disease and have actually been in ICU, intubated and so forth, where we're seeing more specific effects, yes.
All right, so just a quick one then, I suppose, Adrian. What are the symptoms? What should people who are infected or those who fear that they might have contracted COVID-19, what are the signs, the symptoms they need to look out for to see if this is indeed causing some kind of complications with the brain?
Yeah, so I think it's really a matter of monitoring your conscious state, for example, or document what experience you're having, such as dizziness, nausea, vomiting, for example, loss of function in terms of, for example, if you're going to experience a coma, this may lead to loss of particular functions on a particular side of the body, for example, or experience numbness, dizziness, and so forth. So those are the sort of key things that you may want to just keep track of if you've had a specific diagnosis of COVID infection. But I agree, if you have all those signs and symptoms initially that lead you to think that you have had COVID, you recover, you may then experience these particular symptoms that I've just outlined, for example.
All right, thanks very much. We'll leave it there for today. Adrian Puren from the NICD addressing that one of COVID-19 and brain damage and what to bear in mind about